This is Christina. We're going to go ahead and talk about dental and oral hygiene in the dog and cat. Right, these are the different kinds of teeth you find in the mouth. I don't have a dental model, so this is what I have to use. You see here, these are the incisors on the mandible, and then you have the canines, and then your premolars here, and your molars back here, and then on the maxilla you have your molars, your premolars, your canines, and your incisors. The surfaces of the teeth, you have the buccal side, which is the side closest to the cheek, as opposed to the palatal or lingual side, which is on the inside, which is the side closest to the tongue. The occlusal side surface of the teeth is the top portion here. That's the side that they're going to use for chewing, the chewing action. That's the occlusal side surface. You also have the labial surface of the teeth, which is the sides that are most adjacent to the lips. So you're going to right here and up here on the outside. This is the dental formula for dogs. For primary teeth here, you're going to multiply it by 2 for top and bottom. Incisors, you'll have 3 on the left side, 3 on the right side. Canines, you'll have 1 and 1. And premolars, there's 3 and 3 for a total of 28 teeth. And then for the permanent teeth, you'll multiply it top and bottom, the mandible and the maxilla. Incisors, there'll be 3 on the left, 3 on the right. Canines, 1 on top, 1 on bottom, or 1 on the left, 1 on the right. Premolars, there'll be 4 and 4, and then molars, there'll be 2, and then 3, for a total of 42. And as you see here, this is an example of adult teeth. You know, there's only three molars on the mandible, and then 2 molars on the maxilla, but there's 4 premolars and 4 premolars. You can see there the incisors. You have 1, 2, 3, and then 1, 2, 3, 1 canine, 1 canine, and then 1 canine, 1 canine. And this is the dental formula for cats. For the primary teeth, again, top and bottom, you have incisors 3 and 3, 3 on the left, 3 on the right, canines 1 and 1, and then premolars 3 and 2, for a total of 26 primary teeth. And then for the permanent teeth, you'll have 2 times. The incisors are 3 and 3 again, canines 1 and 1, and premolars are 3 and 2, and then you'll have 1 and 1 for the molars, for a total of 30 teeth. Here's an example of some dental radiographs that we took on a dentistry the other day. It's good to have dental radiographs. It checks for any resorptive lesions. Cats usually have resorptive lesions. It checks for any retained roots that might be in there. Also checks for bone loss. Alveolar bone loss and stuff like that. It's good to have those. Make sure you don't miss anything on the dentistry that you can't see. There are several dental disorders associated with the teeth. The first is dental calculus, which is mineralized plaque. You want to make sure this is removed because it could lead to periodontal disease, which could then lead to other things. Removal of the calculus by toothbrushing, good oral hygiene is a definite to make sure that it doesn't lead to other serious dental diseases like periodontal disease. Periodontal disease is defined as plaque-induced inflammation and infection of the gingiva, periodontal ligament, and alveolar bone. This can cause severe halitosis, gingivitis, bone loss, you want to make sure that this is taken care of. Gingival inflammation can lead to the destruction of the periodontal ligament and resorption of the adjacent alveolar bone. It can also lead to systemic diseases if not taken care of because of all the bacteria that's in the mouth. So you want to make sure that you clean your pet's teeth and make sure that if they have severe periodontal disease that they get a dental cleaning or anything like that. Severe periodontal disease can also lead to what's known as an oronasal fistula, which is the connection between the oral and nasal cavities. It's also related to all the bacteria that's in the mouth, causing it eats away at the bone and the tissue that's in the mouth. With oronasal fistulas, because it is a connection between the sinus cavity in the oral cavity, you'll notice mucus discharge, mucopurulent nasal discharge, stuff like that. Periodontal disease can also lead to tooth root abscesses, which is an infection of the root of the tooth, more bacteria that gets in there. This can be painful. You may see swelling. A lot of times when you see swelling up here on an animal, it's the fourth premolar, the carnasal, that's infected. You'll see swelling, discharge from the eye, stuff like that. The tooth either has to be removed or they treat it with antibiotics to get rid of the bacteria that's in there. Other diseases of the teeth are fractured teeth, which are usually caused by trauma. If the pulp is exposed, you want to get this taken care of very quickly. It can lead to more bacterial infection. Could be very painful, so you want to get that taken care of. Another is worn teeth, worn down teeth, usually from chewing. They can wear down the teeth. This can result in, you may have exposed pulp, which can be painful for the animal. So you want to make sure that they're not wearing down their teeth, or, if they do, you want to make sure that you get it taken care of. Another disorder of the teeth are retained deciduous teeth or persistent deciduous teeth. This is you see this highly in toy breeds. It can cause malocclusions or misalignment of teeth. If you have baby teeth still stuck in there, their teeth can become crooked. It can also lead to periodontal disease or labial palatal trauma. So that's another good thing if x-rays, or if there's if the animal's getting spayed or neutered, you want to make sure that those deciduous teeth are removed so the permanent teeth have room to grow in. Alright, when sending a patient home, going over dental care with the owner, you want to reiterate the importance of dental care, and it's easier to brush your teeth every day instead of spending thousands of dollars on a dentistry that they may need down the road. So we would go over like brushing techniques, stuff that you would use. We have toothpaste here that we sometimes give clients, and then they can use a toothbrush. Or sometimes they make finger brushes too, which we don't have, but we have the toothbrush. Brushing technique, you want to make sure that you're doing a circular or a side-to-side motion, and the brush is at a 45-degree angle. This way the bristles will get into the gingival sulcus and get the plaque and calculus that are in there. Sometimes if there's some heavy calculus present, you may see some bleeding. This is normal, and we tell the client, keep brushing through the bleeding, and eventually it'll start to get a little bit better and the bleeding will stop. There are some dental chews and dental diets that are helpful in the removal of calculus from the teeth. We have some of these, they're called CET chews that we sometimes send home with clients. the texture of some of the chews and some of the toys and some of the food helps to reduce the accumulation of dental deposits on the teeth. Just the brushing and like I said, the texture of it helps a lot in removing the tartar or the calculus that's on the teeth. When brushing the teeth, you want to make sure that you get all surfaces of the teeth. So you want to make sure you get the outside or the buccal surfaces of the teeth, the gingival surfaces of the teeth, and also the inside or the palatal and lingual surfaces of the teeth, because if you miss these, tartar is still going to accumulate, so you want to make sure that you do your best to try to get all the surfaces of the teeth when brushing the animal's teeth. And this is important to tell the client when they go home with, you know, a toothbrush or toothpaste. Alright, here I have a hand scaler. This is for supragingival cleaning. You're going to clean above the gingival line here. You can tell by the pointed, sharpened edge. And that's what you would use to clean the supragingival surface of the tooth, as opposed to the dental curette. You can tell it's a little bit blunted. This is subgingival cleaning. You're going to go under the gingival line to get any calculus that's removed. Like I said, this is you can tell by the blunted end of it, and here's the other end you would use. This is task 39, applying a modified Robert Jones bandage. I have all my supplies. I have my vet wrap, my gauze wrap, my cotton wrap, cling wrap, and some tape. And these are the stirrups. So I'm going to go ahead and place the stirrups on Ebony here. You're alrighty. You're okay. You're okay. And start down here and make sure the toes are open. Make sure the toes are open so you can check for any swelling or redness or anything like that. You're alright, Eve, we're almost there. It's not too tight. I can get my fingers in there. You're alright. Hey, you're alright. I can get my fingers in there. So it's not too tight. You go ahead and place the cling wrap. You're alright, we're almost done. Alright, still not too tight. I can still get my fingers in there, so it's not too tight. Go ahead and Her toes are visible, so I'll go ahead and put my vet wrap around it now. Still not too tight. I can still get my fingers in there. Her toes are exposed, so we can check for any swelling or hotness or redness or anything like that. So we can see that. And we usually put a strip of elastic on at the top. Over the elbow joint. Make sure it stays on.